sinuses.
Okay.
And the sinuses are cavities basically in our head and face area. Large sinuses being right here and one above, right above here in the forehead, and a couple more inside. And when these get inflamed, we call it sinusitis.
Okay. Now, what are some of the causes of this?
The cause of it can be multifactorial. There's infectious, of course. When many of us get colds, then we tend to get the fullness right here along our nose, especially when we lean forward, the fullness might get worsened. So the colds can cause it, and of course that colds can be caused by viruses or bacteria. And then you have allergic sinusitis. Many of us down here, when the cold wind starts blowing in, the cedar wind, we tend to get full and flush in the face, so allergies can cause it. And less commonly, there can be direct irritants, but it's infectious and allergic, but mainly infectious.
Is this something that eventually goes away, or should you go see your physician about this?
Like most problems, sometimes they will eventually go away. But the issue is when some of us get severe headaches, fullness, or fevers and chills associated with pain when we lean forward, it's real important to see a physician.
Okay.
But there are other things that we can do to lessen the chances of getting it. And if we do get it, then try to manage them a little better. One of them is trying to get our flu shots. So it's less likely that we're getting flus and colds and other infections that make it more likely or easier for us to get sinusitis.
Talking about some of the prevention there, when is surgery needed for a treatment like this?
First, prevention.
Okay.
Then if you do get it, then try antibiotics, seeing your physician. Now, if you happen to be that type of person who gets chronic or recurrent sinusitis, in other words, even after 2-3 weeks of appropriate treatment, the sinusitis isn't resolving, or the symptoms just aren't going away, then it's important to see a physician who can evaluate you for possible causes of obstruction, that the sinuses can't drain appropriately. So no matter what kind of treatment you have, nothing works until you can get the sinuses to drain.
How does this affect someone? Just, is it pressure that you feel, or?
If it's severe, it can be a big problem. You feel pressure. Some people have pain. Some people have recurrent foul-smelling drainage from their nose. Some people will actually have chronic pus draining out of their nose. So people who have chronic or recurrent sinusitis are very, very affected.
Get it checked out. Thank you very much, Dr. Vijay. And remember, Dr. Vijay is here Sunday to answer all of your medical questions. So if you have a topic you would like us to discuss in the future, shoot us an email at news@